My name is Anna Musket, and I wanted to tell you all about some of the work that I am doing in my lab. In my lab, we study glioblastoma, which is a rare but deadly brain cancer, and since this is a rare cancer, it only affects about 3 to 4 people per 100,000 populace. But for those 3 to 4 people, this is a terminal diagnosis, meaning that those patients who are diagnosed with glioblastoma only have about 14 months to live. This is with chemotherapy treatment and radiation treatment. This is contrasted sharply to the 32 months that breast cancer patients have without chemotherapy or without any kind of treatment. So because glioblastoma is such a deadly disease, many researchers have been studying it for years. Despite all these years of research, however, there are only 3 treatments other than surgery to treat glioblastoma patients. So, what these years and years of research tell me that only resulted in 3 treatments, what this tells me is that we need to better understand what causes glioblastoma, how they grow and form, so that we can better design potential treatments. So, what we are looking into in my lab is in vitro studies. And in vitro is a Latin phrase that simply means in the glass. And what we do with these in vitro studies is we take a small piece of the tumor, which is removed during a surgery shortly after your glioblastoma diagnosis, and we take that tiny piece of tumor and we regrow cancerous cells. Now these cancerous cells, once we regrow them, they can continue growing almost indefinitely. And that is because one of the inherent natures of cancer is to keep growing when they should have stopped. So by taking advantage of the cancerous cell's nature to regrow, we can continually grow these cells and test various different treatments on them. These different treatments allow us to do different doses, different combination therapies, all sorts of things that we would never do with a human patient. These are human patients that are already sick. We're not going to do experimental treatments on them that may or may not help and likely will not help. So, through in vitro studies, we have been able to create cancerous cell lines that we can test these different drugs against, and hopefully, one day soon, glioblastoma will be a very fixable cancer that these patients can live significantly longer than merely 14 months after diagnosis. Thank you.